Due to the increasing spread of the new COVID-19 subvariants in neighboring countries, including India, Bangladesh's Directorate General of Health Services (DGHS) has issued a new health alert. This alert was issued on June 9. In the notice signed by the Professor Dr. Halimur Rashid, Director of the Communicable Disease Control (CDC) branch of the DGHS, it was stated that the spread of new COVID-19 subvariants, particularly Omicron, LF7, XFG, JN1 and NB1.8.1, is on the rise in several neighboring countries. In this situation, there is a risk of the new virus spreading to Bangladesh through international travelers. Therefore, instructions have been given to strengthen surveillances at the land, sea and airport in the country, especially for citizens coming from India and other affected countries, as well as those traveling from Bangladesh to these countries. The DGHS has also stated that health screening and monitoring must be increased at various entry points of the country. It has been instructed to measure body temperatures using thermal scanners or digital handheld thermometers in a non-contact method. Emphasis has been placed on ensuring sufficient stock of masks, gloves and personal protective equipment (PPE) for healthcare workers and on promoting disease prevention guidelines to raise public awareness. Additionally, it has been advised to avoid traveling to India and other affected countries unless it is absolutely necessary. Everyone has been advised to practice regular hand washing, use masks, maintain a 3-foot distance from infected individuals, avoid touching the face with unclean hands, and cover the mouth while coughing and sneezing. Along with this, suspected patients have been advised to stay at home, seek hospital care if seriously ill, and contact with the IEDCR hotline if needed. Desk report, Bangladesh Guardian.